women of the Metro Nashville Police Department that really prevented a massive loss of life as a result of their heroic efforts. And there's been a lot said about how important it is that law enforcement is recognized for its great work, because certainly our community will look significantly different were they not in the middle of a situation like that. So we're really grateful for them. Also, other first responders, the fire department, Nashville Fire Department. I met with the chief on the site when I toured it back several days ago. Members of TBI, Tennessee Highway Patrol, all of the men and women who have particularly worked together to assist the federal agents in getting to the bottom of the incident. So I want to also say that to the business owners, it's been an incredibly challenging year before this ever happened, and now this has made it even more difficult to them. So we are working very hard to find relief via the federal government. We've certainly made requests. The president's indicated we're going to get that declaration, which will provide economic relief. But there are many working in many ways to help the businesses out. Cleanup and recovery is underway. AT&T is working very hard around the clock to try to get back fully services to people across the state. Many state services have been disrupted, and there are continued outages, albeit significantly less than they were in the days after the bombing. There'll continue to be work on making sure that infrastructure is up in place. Before we take questions, I want to talk about the two announcements that I mentioned earlier. Our vaccine distribution plan is evolving, and we are moving. It's been evolved and made public, and we're continuing to address that and will as it moves forward. We are including now, as a layered approach, 75 citizens that are 75 and over. By prioritizing the older, vulnerable populations, we're doing that concurrently with our phased approach that we have put out previously. We think this is going to make our distribution more efficient, more effective, cut hospitalizations and our death rate more quickly. We are continuing to work on this every day. We are recognizing that there are different approaches to this, but the main goal we have is to get vaccines in arms and to quickly get ahead of the infection rate and specifically the death rate in our state. And Dr. Piercy can talk about the particulars of that plan, but I'm proud of the way the Department of Health, public health officials, our hospitals across the state spoke with a CEO today about distribution. Tennessee is getting these vaccines in the arms of Tennesseans in spite of the disruptions in some of the deliveries that we've had. We feel encouraged that thousands and thousands of Tennesseans are getting vaccinated. That's a very good thing. We'll continue down that front. On the education front, I have called a special session on January 19th, which is immediately after the opening of the General Assembly. The urgency with which we address this historic challenge that our kids face is important, and that the special session is being called in order to address these issues early in the session so we can implement them in this year, even as early as summer and certainly in this school year. So learning losses are at record highs. We know that. It's not just a concerning data point. These are consequences, severe lifelong consequences for our kids if we don't take swift corrective measure. And so we all know that we haven't been making the strides in literacy that we should be making. COVID-19 has actually exposed just how poorly Tennessee students read, particularly our youngest students. Special session will be targeted at those things that we can do to really give our kids a high quality education in spite of the challenges of this pandemic. it will chart a course for 2021, but the Department of Education also has work to do with some of the funding that will be coming federally, specifically a program called Reading 360, a phonics-based literacy reading program. We'll be announcing more about that and the legislative package and the details of this special session as those details are hammered out in the coming days. But we will, and we'll deliver those details as they come out. But the most important thing to say about this special session is there's widespread agreement that the need to act quickly on behalf of our kids and teachers. And there'll be discussions about teacher pay. There'll be discussions about and work on districts and funding for districts. All of those things will be worked out in the next few weeks, and they'll be addressed in the special session so that we can get to work before the regular session ends. So a lot of information, a lot of questions that you might have about those things. Let's go ahead and open it up to those questions.
Okay, thank you, Governor. First, we'll go to Harriet Wallace with Fox 17. Harriet, your line's open. Harriet Wallace with Fox 17, do you want to ask a question?
Okay.
Hey, Harriet, we can't hear you if you're trying to talk. Okay, we'll circle back. We'll go to Kelly Roberts with WMC.
Okay, can you guys hear me?
Yes.
Great.
Yes, we can hear you.
Good morning. So can you talk a little bit about whether Governor Lee or Dr. Piercy, about this slight change in the updated distribution plan when it comes to these concurrent vaccinations that will be given to those 75 years and older? Is this something that other states are doing, or does it really kind of set the state apart in its plan from other areas of the country?
Dr. Piercy, you want to address that as you've been talking to your counterparts around the country?
Yes, sir, of course. Thank you for the question, Kelly. I had some familiarity with everyone's plan at the beginning. I haven't kept track of everybody's updates, but to my knowledge, this is one of the few, if not perhaps the only, that's taking this concurrent approach. And regardless of what other states are doing, we want to be sure and have the most effective and efficient plan for Tennesseans. And our plan is based on Tennessee data. We know that over half of Tennesseans who are hospitalized are 65 plus, and 80% of our deaths are 65 plus. And so this concurrent approach takes both age-based criteria and critical infrastructure concurrently, and it allows us to vaccinate our highest risk Tennesseans earlier, regardless of their employment status or their industry. And the crux of all of our decision making is risk. First and foremost, risk to our healthcare infrastructure, making sure workers can stay at the bedside, as well as reducing demand on hospitalization. Second priority is risk to individual health outcomes, targeting those most vulnerable, like I just mentioned. And then third is risk to our society and economy, keeping workforce on the job that's critical to our infrastructure. So we'll see over the coming days how other states are updating their plans, but right now this one's tailored specifically for Tennesseans.
And can I ask a quick follow-up just
Sure.
about that updated plan? I am still waiting to get that updated press release from the health department, but at this point, is this what it looks like? So once you go into 1B, that is where school and childcare staff would be prioritized, and then other first responders, and then the high-risk comorbidities move to 1C. Is that still correct?
Yes, that's all correct. The only thing on that graphic on the press release that you're waiting on is we added a time frame to the graphic. All of the narrative is still the same, so that's that the substance won't change. We were just updating the graphic a bit, and so I'll make sure that gets out ASAP. I'm a little surprised it hasn't already. But yes, your point is well made. 1B. Which is the next critical infrastructure phase that we move into, our K-12 staff and childcare staff that will run concurrent or nearly concurrent with the 75 plus. We've got some counties that are ready to start 75 plus today. And then as they move through that, that's when they'll pick up 1B, and then after that start on 65.
Next, we'll go to Kim Crucy with the Associated Press. Kim, go ahead.
Hi, my first question is for Dr. Piercy. Now that we have a couple weeks of the vaccination distribution under our belt, I was just curious: has there been any reports of spoilage of the vaccines at all?
I am not aware of any instances of spoilage or wastage in Tennessee.
Is that something the state is reporting on or has to report to the CDC?
Yes, ma'am, of course.
I have a quick question for the governor, just to turn it back to the Nashville bombing. I know that you told Fox News earlier this week that you had been in contact with the president regarding the emergency declaration. He has not spoken out publicly, though, about the bombing. Do you think the president should be speaking out more? And I guess my second question is, do you believe that the emergency declaration will be issued soon, or do you have any timeline of when that will happen?
I talked to the president. We made the formal request. He actually called me to let me know that his intent was to grant that request. He was looking at it with his team to make sure it was all in order, but his intent was to do that. And he called to express his concern and to see if there were things that we could that he could do to help. So I'm grateful for that, and we expect that will be granted. There's no indication yet of any issues with regard to the request, but sometimes that obviously takes some time. But we're waiting on that, and I'm grateful for his response to it.
Thank you.
Next, we'll go to Chris Bungard with WKRN. Go ahead, please, Chris. Chris, you're still muted. You got to unmute yourself.
Governor, you have me now?
Yes, sir.
Follow up on Kimberly's question. When did the president call, and what else did you talk about exactly?
I believe the call was made on Sunday morning. I'd have to go back and look, but at my timeline, there's been a lot happened in the last 3 or 4 days. I believe that was on Sunday morning, and that was the crux of the call.
What's your hope on when there may be the immediate relief on the ground from FEMA here, which is really the most important thing, wouldn't you say, that happens during an emergency declaration like this?
Well, I think that what happens is that the work begins to be done by our teams, knowing that we will be able to be reimbursed at the appropriate time by FEMA. So I think just the word of that declaration, the word that it has been signed and that we can begin the work, that's all we're waiting on.
And the other thing, if I may, what kind of things do you want to look at about the outages from AT&T because of the Nashville blast?
Well, I think anytime you have a situation like this, you can look in the aftermath and see where your weaknesses were. And certainly that's what AT&T is doing. They're looking at where the losses occurred. How could we prevent that in the future? It always provides, anytime you have tragic event like this one, or an accident or a disaster, it provides an opportunity on the backside to do postmortem and evaluate how it is that you can strengthen that infrastructure. That's exactly what's happening. And that's what I expect will happen over the next months as this gets put back together. And they have restored virtually all the services fairly quickly, given the amount of damage that was there. So, but there's a lot to learn, and they're investigating that right now.
What about the state contracts that, I mean, there's a very large footprint that AT&T has in this state and also within state government, of course, with the 911 operators. Should those contracts be looked at?
Well, I think the state will probably look at anything that it can learn from this disaster to strengthen our ability to work going forward. That would be the best way to answer that question, is looking at the current structure of what we have, current contracts, how it works. Are there ways to mitigate in the future? And we'll be working with AT&T to determine ways that we can improve the relationship, even now that we know more about it on the backside. But I think both the state, AT&T, other partners, people across the state will be looking at how we can be better after this.
Thank you, Governor.
Hey, can I, before I move to the next question, because Chris, you asked that question and I realized maybe that might be, if I'm understand, that might be the last time you and I get to interact in this setting. Not sure about that, but I do know, I don't know about your timing, but I understand, Chris, that you will be leaving your current job, that you'll be moving on and retiring. And I just want to say to all of us on this call and to people all across the state, you are the definition of a professional. You have a unique ability, sir, to connect to an audience and for them to trust you. You also have had
Governor. I'm gonna interrupt you now.
All right.
I'm only going to do this on this. I'm going to interrupt because there are other questions. I really do appreciate the words. I really do, and we'll talk. But a lot of people have questions, so
I know they do. But man, I had to give you a shout out, sir. It's been you're worth that shout out. So now to the next question. Thank you, Chris.
Next, we'll go to Marta Aldrich with Chalkbeat TN. Marta, go ahead, please.
Can you hear me?
Yes.
Great. My first question is for Dr. Piercy. I have one other question as well. Dr. Piercy, regarding that distribution plan, based on your previous answer, it sounds like teachers and childcare staff have now moved ahead of adults with 2 or more high-risk conditions. Are there other groups that educators have now leapfrogged over from the previous plan?
Thanks for the question, Marta. We have moved teachers, K-12 staff, childcare, really to the top of the list, right behind healthcare workers. And that all goes back to the emphasis I placed a few minutes ago on risk. And it has to do with risk to our society and economy. Because we know, as the governor mentioned earlier, when children are in school, their societal and economic impact is strengthened when they are educated and when they are more literate. So we want to do it for children. We want to do it for parents in order to have kids in school so parents can go to work. In no stretch of the imagination do we ever link vaccination of teachers to school opening, because we are staunch advocates for schools to be open now. But this will help us further keep teachers in the classroom and kids in the classroom, which is the best thing for our society and our economy.
I understand that, but when you move groups up, you have to move other groups down. And I understand what you're saying, but just for clarity, can you help me understand which groups now have had to move down? There's that those with high-risk conditions. Are also other critical infrastructure workers, are they moving ahead of other critical infrastructure workers?
So there have been a lot of iterations of the plan. The biggest one, as you mentioned, is the 1B phase of teachers coming up behind healthcare workers. And I think it's important to also recognize that the concurrent age-based criteria helps get all of our highest risk Tennesseans vaccinated earlier, regardless of their employment. You know, we've had a strong focus on equity throughout this entire process. And so moving them up and perhaps others going further in the line is certainly absolutely no value judgment, no statement of worth or importance. It is just a calculus based on assessment of risk while in the face of scarce allocation.
Okay. Okay. I'll go ahead and ask a question for Dr. Schwinn, please. Can you tell us more about Reading 360 and how this is the same or different than the reading proposal that almost passed the legislature this spring? And also related to that, can you tell me what contracts the state is seeking to enter into related to this initiative, as well as their status?
Yes, so appreciate the question. So literacy and helping our kids read has been a priority in Tennessee for a while now, as you know. I think now we have the opportunity to leverage one-time federal funding and federal grant funding to invest in our kids and certainly in our state. When we talk about Reading 360 and more details will come on Monday, we also know that this is going to take a comprehensive approach, everyone working together, districts, teachers, families, et cetera. I do want to be clear that Reading 360 is not the name of a policy. It is programmatic support to complement any potential work that the General Assembly would do related to policy and statute. That is absolutely something that they will talk about, debate, and take up. These are supports that will really target the needs of our districts at the local level and allow for a lot of local decision making and autonomy on how they implement and choose to take advantage of any supports we provide. Again, we are very excited to roll out more details of the program on Monday. And that's when I think I'll be able to answer a lot more questions specific to Reading 360 as the programmatic complement to anything that would happen legislatively during special session.
Okay, can you speak to the question about contracts, or is that also Monday?
So everything related to program would be on Monday, but certainly as we think about processes, et cetera, the department will continue to adhere strictly to any kind of statutory policies related to contracts. And I'm very excited that we are opening up and including significantly more people in that process to increase transparency, and been working with CPO to pilot that and launch that in our policy work, or I'm sorry, in our procurement work. So again, we'll be able to talk more about programs on Monday.
Okay, thank you.
Yes.
Next, we'll go to Stella Yu with the Tennessean. Stella, go ahead, please.
Hi, can everybody hear me?
Yes.
Okay, awesome. So yeah, my first question is addressed to Governor Bill Lee. And so kind of following up on Chris's question. So I'm wondering if there is specifically anything at the state policy level that state lawmakers or the state administration in general can do in light of the bombing and the disruption to the telecommunication network?
Well, the primary thing that we can do is work together with the private partners like AT&T, and we've had regular daily, many times a day communication with them to assist with any information we can give them, with the partnerships that we work with them, the contracts that we have with them, the way they work with 911. We've just been partnering with them to make sure that we can work together to mitigate the challenges that we've had statewide.
Sorry about that. I was muted. Yeah, so a follow-up question to that, still Governor Bill Lee. So you've spoken to AT&T officials, and what specifically did you ask them to do to make sure that this never happens again? And if so, did you ask them to do more?
So really, we're in the middle of this crisis, And our communications with them have been, how can we help you, and how can you help us? How can we get people back online? That's the effort right now. It's to get all the services back up and running. The ways to improve in the future, and then looking at opportunities to strengthen our communications infrastructure. That'll be after we get everything resolved and back online. That hasn't happened yet. So our communication has basically been, how can we work together? We will move. I'm sure they'll move into a new phase of what can we learn from this and how can we be better. But right now, it's how can we get people services they need.
All right, Governor, that's all the time we have for questions today. If you would like to close us out.
Thank you all. A lot of information, a lot of news, a lot of things happening in our state. I certainly am grateful for the role that each of you play in disseminating that information. Our people across Tennessee need to understand and know about vaccines. They need to know about the work of education. They need to understand the work that's being done to restore services. And I appreciate the role that each one of you play in that. We are hopeful for and praying for a new year that brings great blessing to many Tennesseans in many new ways, especially as we address the enormous challenges that we are walking in these days. We'll continue to address those challenges and move forward. And again, just my last shout out to Chris Bungard. Thank you, sir, for all that you've done.